Don't live with back pain the rest of your life. There's a reason why most people with herniated discs never get better. We're gonna talk about what you can do about it in this video. Let's dive in. Most of us think that discs are static, that once we have a disc bulge like this side, that disc bulge right there, once that disc is bulging out, like it's gonna stay that way. It looks terrible, right? It's taking up space. That's a problem. It's putting pressure on the nerve. But what actually happens within your spine is that it's malleable, it changes. So when we put pressure down, straight down on the vertebra in our spine right here, we're pushing down and it's not perfect, but it's not putting pressure on that nerve. When I go into extreme flexion, it puts pressure on the nerve by pushing the disc out the back. When I go into extension, I put pressure on the nerve in between the bones. So if I have good pressure coming straight down, our body is designed to take on axial load, our spine is designed to take on pressure coming straight down, then I'm not gonna have that disc bulge pressing on the nerve. So we're gonna talk about more specifics around that. When you have a herniated disc, we often have a lot of pressure on that nerve. So we're gonna talk about that link right here. So coming out of our lumbar spine, out of our back, all these nerves come into one branch that comes right through here, through this sciatic notch. And when we look at this model right here, you'll be able to see it. So that's that sciatic nerve coming out the back. So when we were looking at that, a disc protrusion, when that disc comes out, that herniated disc, it puts pressure on that nerve. That's what causes us problems long-term. Once we put pressure on the nerve, we just have to tap it one time and then the muscles will seize up around it and that starts causing us more problems. We've got to be able to create space for that. We change the body by changing our movement patterns. We need to make sure that we're putting load through our hips and through our thoracic spine, and we limit the amount of load that goes on our lumbar spine. When we do that, we stop pressing on that herniated disc. If we stop pressing on it, then it's malleable and it can change. We had a client that came in here, he had an 8mm disc bulge, and then we worked with him for 6 weeks, and he gets an MRI every year. And when he went back for that MRI, he had a 4mm disc bulge. So it changed by 50%. And we didn't do anything directly to the disc to make it go back in. What we did was redistribute load and pressures. And that's what we're gonna teach you in this video, is how do you change your movement patterns so I can keep my spine in a neutral position that maintains as much space for that nerve as possible, and we stop putting compressive load on the disc, so we stop herniating it and pushing it back out into the nerve. When we look at the spine right here, all these nerves are coming out. I want to keep my spine in a neutral position. I want to load through my hips and load through my thoracic spine. So anytime we're playing a sport or walking or running, everything is a reciprocal motion. So I'm moving with my right arm and my left leg at the same time. And every time I'm doing that, I want to make sure that I'm rotating and I have a good balance through the muscles and make sure I'm maintaining space for that herniated disc. If we can decrease the amount of stress that we put on that disc, then we're going to maintain that space. And that's how you're actually going to get success. When we run into problems is when we pair our back extensors with movement. So when I want to hinge through my hips using my glutes and my hamstrings, keep my spine in a neutral position right here, what ends up happening is we don't use our butt enough. So our knees will shift forward and then we'll move through our lower back. So I'm moving through my back extensors all the time. Or I bend over to grab something from the ground and I move through my back. So I'm always moving through my back extensors. If I move through my back extensors, I'm beating up on that herniated disc. That's what we want to limit. Make sure that you hit the subscribe button so that you get all of our latest content on exactly how we fix this stuff in the clinic. We'll make sure that you hit the bell icon so you get notifications, and then leave comments and let us know what you want to know specifically on how we can fix the problems that you're dealing with at your house. Most of the time when we have a herniated disc, people want to do stretches to fix it. But what happens is we do too much stretches. We stretch right through our back. We're trying to lengthen because it hurts. And that'll give somebody relief momentary for maybe a minute or two, but then it gets hurt. It hurts actually worse because we're moving in an area that moves too much. We're constantly having inflammation that's putting pressure on that nerve. And that herniated disc, we're moving and we're putting pressure on it. We're putting pressure on it. So when we look at the disc and how we're putting pressure on it, that's gonna make that disc herniate, and we continue to create a problem that won't go away. So what we need to do is 3 simple things. The first thing that we need to do is a glute rollout. We need to roll out these muscles right here on the glute. You see how these muscles are overlapping each other. So I'm gonna put pressure, put this lacrosse ball up against the wall, and I'm gonna dig into that muscle for about a minute, just loosening up this muscle, making sure that I'm increasing the glide for the muscles, and then I need to use them more. Number 2 is a hip hinge. We need to make sure we're moving through our hips. So I allow my chest to come down and I'm pushing my hips back. How can this fix a disc herniation? Your disc herniation is there, it's malleable. If we take stress off of it, then it'll start to go back in. It's never gonna be perfect. And people shouldn't be jumping to go have surgery. We see so many cases here in the clinic where they thought that the surgery was gonna take away their pain, but they still have the problems that create the disc herniation. The best thing that you can do is change the movement pattern. So the first thing we were talking about was to loosen up the muscles. The second thing is to make sure that we have a hinge position. So I'm coming back here, or if I'm sitting down, I'm pushing back down into the chair. My back stays in a neutral position, and then I'm training these movements. I want to keep my Superman emblem, Superwoman emblem stacked over my belt buckle as much as possible. So I'm moving through my hips right here. This is staying stacked. And that's good athletic movements that we're moving through the hips. So the first thing we did was loosen up the glutes with the lacrosse ball, and then we start to use the glutes by pushing back. Even when we're sitting in a chair, I'm pushing back, coming back into my hamstrings and my glutes. I'm not bending over, I'm not bending like this. If I bend and sit down in a chair like this, I'm bending through my low back, and that's cranking on that herniated disc. That's what's making it worse. I wanna leave that herniated disc alone. I wanna allow my body to get rid of that inflammation and actually heal. It won't be perfect, but it's gonna be a lot better, and you're not gonna have pain. If you can train yourself to bend in this way, where we push the hips back, allow the chest to come down, and we sit down, and then we always sit with our butt against the back of a chair. When people are sitting, this is the third thing we're gonna talk about. When people are sitting, a lot of times they hunch. None of us like to sit with perfect posture all the time. It's uncomfortable, me included. We sit at the computer, we sit at our phones, but when we slouch like this in a chair, we're in flexion. And we were talking about that disc, how when we go into flexion, it pushes the back of that disc out. It makes that herniation bigger. And so we've got to change that. We've got to make sure that our back is in a neutral position as much as possible. And the best way you can dictate that is by having your butt touch the back of a chair and then come down, sit in the crevice, and then you can sit up tall. If you're laying on a couch, having support on your back and laying down in a position where your back's in that neutral pattern, neutral position as much as possible. Number 4, when you're in your car, you know that there's lumbar support. So they're always pumping up that lumbar support so that you can go into this position. It's supposed to be good for you. That's overdone. We push ourselves into too much extension, and that puts pressure on our vertebra, and that's closing down the space for the nerves. Flexion puts more pressure on the disc. We want to stay in neutral. So we want to lessen that. We need support on our back where it's touching our butt and touching our lower back, but we need to respect that we have this little curve through our lumbar spine. And so when you're laying down on the couch or we're sitting in the car, we want to maintain this just natural curve as much as possible. We don't want to hunch too much in our upper back, and we don't want to extend too much in our lower back. These natural curves, if we push them too far, it's very easy to go further into that lordotic curve and get more extension out of our lower back. And it's very easy to get, well, I'll do it with the skeleton. It's very easy to get more of this hunched over through our upper back and more of that extension through our lower back. So we got to make sure that we're staying in those neutral positions. That's going to take the most pressure off of that herniated disc and going to help you long term. Number 5 is not doing too much back extension. So there's something called extension rotation syndrome. And that's what most of the back problems people have, that's where they start, is that they extend and they rotate at the same time, and they're closing down that space for those nerves. But when we extend and we rotate, we also have to go into flexion. So we're changing from flexion to extension. We're constantly moving through our lower backs, and that's what's wearing out that disc. The more that you can stay in neutral and limit back extension, the better off you're gonna be. So that's all of our clients, we're focused on neutral patterns. I need to keep my Superman emblem stacked over my belt buckle. Like we talked about in this video, I need to keep these stacked as much as possible so I'm driving out of my hips. I still need to be able to grab something off to the side. I still need to be able to pick something up from the ground. But when I do it, I use my hips first, reach down and grab something. And that's gonna allow my disc to actually heal over the long term. We have videos on specific exercises and specific stretches on what you need to do to be able to heal your back, heal the sciatic nerve, and all the way up and down your spine, how you're gonna get better through those muscles and get the whole body functioning better, and so that you get yourself out of pain. In this video, I wanted to attack why people have problems with herniated discs and they just don't go away. So make sure that you hit the subscribe button, and we'll catch you in the next video.